Haley Casper with M191 News. We have breaking news coming in from the CDC. As some of you know, we are in the midst of a crisis regarding an unknown illness that is spread through the southwest United States, specifically among the Four Corners. 5 patients have become ill so far. We have received these charts detailing the symptoms and other commonalities of these 5 patients. We see here that the patients are dying of fluid in their lungs, and some have symptoms such as vomiting and diarrhea. One of the more worrying commonalities, of course, is the death of these patients. Pulling up a second chart, you can clearly see that the patients all had contact with the outdoors, whether at parties or by hunting, fishing, or trapping. The majority of the patients also get their water from a well source. So far, the Office of Medical Investigation does not have enough information to narrow down the disease, but they can tell us what they do know. We go now to the CDC for an explanation of what this could be.
For joining us in our lab. I am Dr. Lexi Spencer, and I'm here to take away any, or at least some of the fears that the public might have concerning this mysterious illness. When most people hear of an outbreak, they conjure up the worst possible scenarios. For us, the worst possible scenario will be something like Ebola. Luckily, we can rule that out based on the lack of severe hemorrhaging or bleeding out. Another hemorrhagic fever that we sometimes look at is Lassa fever, which can also be ruled out based on the lack of hemorrhaging and a sharp backache in the victims of this disease. Congo hemorrhagic fever is the last disease that we can rule out based on the symptoms, which include bleeding gums, blindness with fevers, and icteritis, or swelling of the brain. Now that I've explained the good news, I'm going to turn it over to my colleague, Dr. Kelly Carmack, to tell you what we could be looking at.
Hello, thank you for joining us. Now I want to say before I go over the possible diseases we could be dealing with, I am going to emphasize that we really don't know what is causing the illness in these patients. And nothing I am mentioning right now has been proven as the culprit disease. That being said, we are considering Legionnaire's disease, which does cause pneumonia, and as well as the fever and muscle aches we have been seeing in these patients. It also could be that we are looking at the flu, which can be deadly and could account for fever, cough, and headache seen. The bubonic plague is also a contender, being that it causes the fever, lethargy, and coughing, and pneumonic symptoms. Again, none of us here are sure, which we should keep in mind when I tell you that we are also looking at anthrax, which causes bronchopneumonia, labored breathing, and bloody expectorant, which was present in one of the patients. Hantavirus is also a possibility, as it causes fever, weakness, fatigue, and high white blood cell counts in patients infected. The last cause of illness we are considering is a pesticide by the name of Fogshu. Symptoms resulting in exposure to chemical includes the destruction of lung tissues, difficulty breathing, fluid in the lungs, and ultimately respiratory failure. Right now, we just don't have enough information. Thank you for joining us, and now we will keep you updated.
Thank you very much, Dr. Spencer and Dr. Carmack. Our thoughts are with you as you try to find out more about this outbreak. Stay tuned to M191 News for the latest news regarding this outbreak. Good evening, everyone. I'm here with some updates from the CDC regarding the outbreak of a mysterious illness in the Four Corners region of the United States. We have received word that the illness has now been found in 24 people. 12 are dead. It has also been found that the people have not been dying of pneumonia or shock, which can help the CDC get closer to identifying the disease. The Office of Medical Investigation also sent a document that the CDC has been able to share with us, detailing more about the symptoms of the patients. Fever, muscle pain, headache, cough, and gastrointestinal symptoms still account for what doctors are seeing most in these infected patients. They've also been seeing increased respiratory rate and heart rate, as well as fever and high white blood cell counts. For more about what this means, we go back to our friends at the CDC.
The more reports of illness, the more cases that occur, the more we know and the closer we go to finding and preventing this mysterious disease. As Haley said, we are able to eliminate pneumonia as a case of death in patients, therefore helping us narrow down the possible diseases. More testing will be needed, and we look forward to keeping everyone updated as we get closer to be able to tell the public what exactly we are dealing with.
Good morning. Haley here with more updates concerning the outbreak in the southwest United States. The CDC has notified us that they have received word from the Office of Medical Investigation that the following diseases are now out of consideration for the outbreak occurring in the southwest United States: bubonic plague, influenza, legionnaires, anthrax, or phosgene poisoning. For more details regarding why these diseases have been eliminated, we go once again to the
Hello,
CDC.
it is a good morning here at the CDC as we have been able to definitely eliminate some of the diseases that were possibly reasonable for the illnesses appearing around the Four Corners area. The OMI has found that, as mentioned by our friends at the M191 News, that the plague, the flu, legionnaires, and as well as anthrax and phosgene were eliminated from the possible diseases causing the outbreak. We are receiving antigens to test patients for antibodies to anthrax, Congo crimin, hemorrhagic fever, Ebola, Lassa fever, Marburg, and hantavirus. The test referred to as ELISA will help us know what diseases the patients have antibodies to and therefore have been exposed to. For more information about the ELISA testing, I will hand it over to Dr.
The
Lexi
ELISA
Spence.
test is an enzyme-linked immunosorbent assay to test for the specific antibodies against an unknown patient antigens. This will help us to determine what disease we are dealing with. We already have some of the patient antibodies delivered. We got delivery of antigens for this test. We first place the known antigens in a variety of wells, and then we place the patient's antibodies into the wells. And if they connect to the antigens, they will stick and stay there. Then those that aren't able to connect, we just rinse away. We then add a secondary antibodies that connect to the primary antibodies to help us to be able to tell that the antibodies were able to connect. We then add an enzyme substrate which connects to the secondary antibodies, and then after rinsing everything that wasn't able to attach, the color will actually change. That therefore be able to give us a complete description of what antibodies these patients have.
Thank you for this information. Please let us know when you have the results. The nation awaits the end of this ordeal. That is all for tonight. Thank you for joining us, and tune back to M191 News for all the latest developments regarding the Four Corners outbreak. America, this is Haley here, and joining us today is Dr. Smith from the CDC, who has updates regarding the outbreak in the Four Corners.
Hello, thank you. We have some really good news finally, that we've had the answer to what caused the illness in Four Corners. The disease that has been going around in Four Corners is called hantavirus, which we briefly explained earlier at the beginning of our investigation. Hantavirus is a virus and is caused by various types of rodents. When these rodents' droppings get stirred up, the patients can inhale the spores that are on the droppings. The virus itself, which we brought a picture to show you guys, is enveloped with a lipid membrane that it contains attached glycoproteins. The genome is made out of RNA, which is not like human genomes because humans have DNA as their gene substances. The RNA genome has 3 segments to encode. It encodes viral transcriptase, enveloped glycoproteins, and nucleic acid proteins. The virus replicates inside of the human cytoplasmic membrane. Now, as your listeners might be hearing, they may not understand what I said. So for the people out in the community, we need to be focusing on how to actually prevent the disease and how to treat it if you do get infected with hantavirus. Prevent the infection is to avoid droppings with rodents and wild rodents in general. Unfortunately, there is no current treatment for the syndrome, which is called HPS, and HPS is caused by hantavirus. But if you are able to early on to identify the disease and HPS, you can prevent death by treating the person for the HPS disease. There is some research being done on vaccinations for the Asian hantavirus and the European Puma hantavirus. But these vaccines are not yet proven effective against the American hantavirus, although there has been some theories that they could be used in the future. Just like the vaccines, there are antiviral drugs, and they have the same thing. They are effective against the Chinese hantaviruses, but we're not sure that they will actually work on the American hantavirus. And the antiviral drug, by the way, I forgot to mention, is called Ribavirin. Because of these unknown effectiveness of these treatments that I mentioned that were related to other diseases in other countries, we once again recommend that you guys avoid rodents and to do your best to prevent the infection. And if you come up with any of the symptoms, to immediately go visit your caretaker and your practitioner. Thank you guys very much for keeping the public updated on this situation, and we hope again to work with M191 News again in a more pleasant scenario in the future.
Thank you, Dr. Smith. We are very thankful for your knowledge and advice to the public, and we're happy to have an ending to this outbreak. For M191 News, I'm Haley Casper.